So today I just wanted to speak to you about the glucose tolerance test, which is a test that we do quite frequently in pregnancy, I would say. Lots of women have been invited to have this test, and I don't know. I feel that sometimes people don't appreciate why this is being offered to them, what exactly that test sort of highlights, if you want, and when exactly it needs to be done and how, and all of those things. So I thought it's an important topic to talk about, so I thought I'd do a short video to tell you a bit more about it. So the glucose tolerance test, or we call it GTT for short, it's basically the same the same things, it's just the initials. It's usually offered to women in the UK anyway. It is offered to women that have risk factors for developing diabetes in pregnancy. In other countries, it's offered to all women. For example, when I was working in the Middle East, it is offered to all women regardless of risk factors. But that is because it's more prevalent in those countries. So in the UK, it is actually offered to women who have a previous history of gestational diabetes in previous pregnancies. It is offered to women with a high BMI, women who have first degree relatives, so the parents or maybe sibling who has diabetes in the family, and it is offered based on ethnic origin. So regardless of obviously the country where you're actually born, if you are from an African, an Asian, or Middle Eastern background, then it will be offered to you as well. Now, when this test gets done, so it's usually done somewhere between 24 and 28 weeks. Hopefully, by that time, you would have understood the reasons behind it. Why is this being offered to you? Typically, it is done around 26 weeks. And that is because gestational diabetes tends to sort of develop a little bit later. So it's a bit less likely to develop in the first trimester of pregnancy, is more likely to develop a bit later on from the second trimester onwards. However, this being said, if you've had a previous history of gestational diabetes in another pregnancy before, then you will be offered to you earlier on at 16 weeks. And then obviously if it's positive, then we treat it as such. But if it's negative, then you will be offered again at 26 weeks, again because the risks of developing do increase as you progress throughout your pregnancy. Now, where exactly this is being done? So most of the times it's being done in the maternity unit itself, in a hospital environment. That is because obviously you'd have to stay there, they would have to monitor you for 2 hours, to keep an eye on you. Sometimes you might feel a little bit unwell with the test. And in terms of preparing for your test, is you'll have to be fasting. Okay, so usually it's about 10 hours that you'll have to be fasting before your test. The tests are usually scheduled early in the morning, so somewhere in between 8-9 o'clock until maybe 10 o'clock, so that you don't have to fast for a very long time in the day. But it just means that you'd be having your dinner. What I usually say, avoid having a massive meal, because sometimes we might get these so-called false positives in a way, just because your body still didn't manage to have, to metabolize all the sugars and the carbs that you've had the night before. So avoid having a super large meal the night before of your glucose test. Okay, so just a normal meal, and then after that you'd have to isolation. It's just common now. No, sorry, you'd have to be fasting from after your dinner. You can have small sips of water, but you'd have to be fasting from the night before, so about 10 hours until your test. Now, when you go for your test, be prepared to be there for probably about Well, all in all, I would say maybe 3 hours. Okay. What they will do, they will get some bloods from you initially. Okay. Then they will ask you to drink something sugary. Actually, it contains 75 grams of glucose, and a bit of water with it. And then after that, you would be going back into the waiting room, and you'd have to be staying as still as possible. Obviously, you can use the toilet and so on. But you'll be have to wait there for 2 hours without going out for a walk or anything that might actually help out with metabolizing the sugar in your body, just to see how your body sort of reacts to that load of sugar. Okay, now most of the time, you're within those 2 hours, your body will be able to sort of assimilate and metabolize it, so you'll not have quite so much sugar in your body anymore after the 2 hours. So that's exactly what the test does, looks at how much sugar you still have in your blood 2 hours after. Now, in terms of results, then, as per NICE guidelines, which have been updated a few years ago now, so NICE is what we tend to use in the UK, but lots of other countries have adopted the same guidelines. However, you might find, if you're in a different country, you might find that the actual value is slightly different than what I'm going to tell you now. However, we go with NICE guideline, which is the National Institute for Health and Care Excellence. So according to their guideline, we consider the normal range of this result, so the glucose test, anything that is less than 5.6 as your initial blood test, that is minimal per liter, and a maximum value after the 2 hours is considered to be 7.8. So if you have anything above 5.6 at the start or 7.8 after 2 hours, so either of those two or both, if it's higher than those values, then you'll be considered positive for the GTT. That means that a diagnosis of gestational diabetes can be done based on these results. Okay, usually these results get checked by the midwife usually, and well, generally they don't take very long, but obviously then it might take a little bit of time before they can actually communicate the results. And then what we do with the results, so like I say, it is a gestational diabetes diagnosis. Okay, we will then refer you to our diabetic team, which can be specialist midwife, or sometimes they're nurses that are specialists in this area. They will then get in contact with you. They will be asking to monitor your sugar throughout the day, so to see how certain foods impact on your glucose levels as well throughout the day. And then based on those results, you'll then start to understand what works for you in terms of keeping it under control. So obviously there will be a series of exercises that you'll have to do, possibly adjusting your lifestyle in that sense, you know, looking at exactly what you eat and how it impacts on your blood sugars. Now, this doesn't mean that you'll have to do anything else, okay? So provided that your blood sugars stay within a normal range just by adapting your lifestyle, then it might be that you don't need anything else. Some women, however, do struggle with keeping it under control. And so in those situations, then obviously there's some medication that you'll be offered, but we always start with the minimum that we can give you and then see how your body reacts to it, and then increase, you know, as needed, obviously. Okay, so it doesn't mean that you'll go on an insulin straight away, put it this way. Okay, but obviously they would be able to advise you. Now, in terms of other things that might happen throughout your pregnancy, so if your pregnancy was deemed as low risk up to that point, obviously now it becomes more of a high risk pregnancy. So that means that you'll also be referred to see the consultant if you've not seen them before. They will talk you through all of these. They will keep a close eye on your pregnancy and make sure that is well managed in that sense. you will be also offered more scans. So I always say this, when your body doesn't metabolizes the sugars as well as it should, then it means essentially that within your bloodstream there is more sugars. Okay, so obviously those do get a baby as well, and it's just a bit like us, right? When we have lots of sugars around, i.e. lots of cakes for in our case, right? Then it tends to make us a little bit chubbier. Okay, so the most common marker, shall we say, in terms of baby growth, okay, fetus growth, is one of the markers is the abdomen circumference, so the circumference around baby's tummy. So of course, when there's more sugars about, that tends to get a bit larger than what we expect. Okay, just the same like us. If we have too many sugars, we don't grow taller usually, we just grow a little bit chubbier around our stomach, right? So babies are exactly the same, and they do exactly that. So that's why it's important to kind of monitor the baby throughout and see if the baby now becomes quite large. Okay, again, it very much depends on how well the blood sugar is monitored throughout pregnancy and how well you manage to keep it at a normal level. Doesn't mean necessarily that you'll need an induction of labor or in fact anything changed to your pregnancy as such, but obviously it all depends how things are. Okay, so it's just a matter of keeping a closer eye on you. um yeah, apart from that, I think that's pretty much it. Obviously, there's a lot to talk about gestational diabetes in general, how you can avoid it, how can you manage it. But obviously, this was just intended as a short clip to tell you a bit more about the actual test and just a brief of a look of in terms of follow-up. So it is an important test. If you've been advised to have it, please do go ahead and have it. And what I would say for the test in itself, because like I say, you need to be there for a couple of hours in between blood tests, do get something to keep you amused for that time. So bring a few magazines, make sure that you have battery on your phone if you're going to browse through the internet or go on social media. And then yeah, wait for the results and see what they are, and take it from there. So I hope this is useful. If you have any questions, please let me know. More than happy to help. Have a good day and speak to you soon. Bye bye.